morning, friends. Welcome back to my YouTube channel, Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe my channel and also please give your valuable comments. And you can also visit the playlist. In the playlist, all the matters so far we have discussed has been given in a very systematic order so that it is very convenient for the study. Anyway, since the last few classes, we were discussing about autism and its consideration in Ayurveda. So we are now looking into the basics, and the basics we have already completed 3 or 4 classes. So today we will have another discussion on the same, that is approach to autism in a very young child. Question is when to suspect. Okay, suspicion is very important here. If you diagnose the autism case at the earliest, the chance of recovery is more. And if you diagnose the case at the later part of the life, then almost all the prognosis is bad. Now, how to have a approach for the autism in young child, how we can diagnose it earlier. Now, one of the approach is symptomatic approach. Symptomatic approach in the sense, we know that autism will have some developmental problem, especially 2 important domains of development, social developmental milestones and as well as language developmental milestones. So you can keep eye on these 2 particular developmental domains so that whether the child is attaining these 2 important developmental milestones normally as per the chronological age or not. This is number 1. Okay, early suspicion. Development. Now we have got so many social development like saying tata, bye bye, giving social smile and responding for your stimulus. They are all the social developmental milestones which is seen in the early part of the life. If it has been developed normally, we can say yes, it's okay. Similarly, speech, starting from the jargon speech, we have got monosyllables, bisyllables, and after 1 year, after 12 months, usually child start joining the 2 words like papa gaya, mummy aya. So like that, usually in the 2nd year of the life, child will have tendency of joining the 2 words. So these are some of the points that you can see. Third one is behavior. What is the behavior of the child? What is the behavior of the child? Behavior, whether it's introverted or extroverted, or he's exploring the world or not, or he is very dull, he want to be alone seldom. So all these things we can assess in the first part of the life, especially in the first year. So this may give an early clue to the diagnosis of autism. Another important is abnormal hearing and vision. You can also check into these 2 parts, whether the child is able, because language milestones are get affected now. To that, why the language developmental milestones are affected? Because sensory cut is there. He is cut off from the sensory parts. So sensations are not received properly. So when sensations are not received properly, the language developmental milestones, including the communication, is not get developed. That's the reason. So you can check this particular abnormal hearing from the beginning itself. Okay. So because if the hearing is get affected, definitely the language and communication will go into delay. So usually the babies with the autism will have problems related to the hearing and because of the vision. That vision problem and hearing problem is not because of the anatomical or structural defects which are present inside the ear or eye. It is because of the failure of sensory transmission. Sensations which are received, so they are not transmitted to the upper part of the brain like hypothalamus and cortex, and therefore the problem comes and child is not able to appreciate the meaning. Our child is not able to understand what is actually happening, what he has seen and what he has heard. So that is one important thing that helps to you. In olden days and even nowadays also in the village area, if you see, so there is usually they will sing some of the songs. We will call it a lori. So lori will be sang to make the baby sleep. Okay. So usually हम लोरी वगैरह गाते हैं, लोरी गाते हैं, ठीक है. So see, this was actually one of the diagnostic tool where identification of the hearing defect of the child at the earliest. If the baby is responding for that particular song or Rodi, definitely it suggests that the hearing capacity of the child is very good. Even after singing the song also, the baby is not responding and baby is rather crying more, suppose, then definitely he may have some, I cannot say always, he may have some hearing difficulties also. So maybe in those days it was in a one of the measure which is used to detect such things. Anyway, Another is scholastic performances and achievements. Now when he go to the school, especially maybe that kindergartens or nurseries, etc., so usually the scholastic performances, whether he is able to appreciate the word, he is able to identify the word, he is able to utter, whether he is able to give a response to the teacher, he is understanding what the teacher is telling, all these facts and the comment feedback from the teachers to the parents, they also helps to identify this condition at the earliest and including the achievements. Now an autistic child may have two types of responses. It may be hypoactive or it may be hyperactive. Sometimes it may be, most of the time it is hypoactive, and sometimes it may be also hyperactive. Hyperactive in the sense that the outward sensations from the outer world is not reaching, so baby is now developing its own way of giving motor responses, and sometimes these motor responses are not in accordance with the sensory input, isn't it? So that motor responses may be exaggerated, and that gives the impression of a hyperactivity. Okay, see, any motor responses, if it is according to the sensory input, then it is a well balanced one. Now in this case, what actually happening is, as a child is not receiving any sensory input from the outside, so child now gives some of the responses by its own, irrespective of the sensory responses. So many times it may be hyper exaggerated. So that gives an idea of a hyperactivity. Another important is there may be any other coordinated manifestation. Now autism may be associated with the mental retardation. Sometimes autism may be associated with the tremors. Autism associated with sometimes ADHD like symptoms. Autism may be associated with some other higher mental functions problems. So all these comorbid manifestations will be there. Sometimes autism like symptoms may be also a part of the syndromes, many of the syndromes which is developing in the children. So these are all considered the comorbid manifestations of the autism. Now we have also got some other symptoms which is helpful to identify the autism, that we will discuss in the next class. Thank you very much. So please don't forget to subscribe my channel.